Okay, so today for Sufr, as a PAL rep, I'll speak a bit in terms of what is happening in Sufr as well as what is happening at the Ministry of Commerce. For the Ministry of Commerce, some of you were at our press briefing, but I am pleased that we are moving forward with our cannabis bill. So I'm really hoping that now with the establishment of the RSA and the appointment of the CEO and the corporate secretary, that you will help us spread the word with the discussion on our cannabis bill, because as you know, it was the work that we're doing on cannabis that caused us, when you look at our structures, to set up the RSA. So now that we have set that up, we are back on the first item on the agenda, and that is cannabis. So the coming weeks, we are going to have public conversation, public discussion. So I really urge you to keep that discussion on for us, assist us in causing the public to take a keen interest on that bill, that is a draft bill that is up there for circulation and discussion. It is very important for us because we have worked quite a bit to try to get a model bill, and now we want feedback from the general public. So that is what's happening at our ministry. The second thing I can speak about, we continue to work on our MSME loan grant program, and I want to take this moment to ask persons who apply, those who have not actually got their matters finalized, to bear a bit with us. We are, as you know, processing still applicants from the second calling, and until we finish, we cannot have a third calling. So we are still working on the second calling. So that is our MSME loan grant program. Now to the constituency of Sufr for Shajak. Last week, some of you made the covering of our historic events where we had 4 yachts in the harbor. I think you all covered 3. And that is not by chance. It is the work of a government that is focused on transforming Sufr for Shajak, as well as the work of the Ministry of Tourism, Minister for Tourism, and the work that we're doing collectively to increase the number of visitors. So I want to take this moment to thank the Minister for Tourism, the staff, the PS and staff of the Ministry of Tourism, as well as the board members of the Sufr Regional Development Foundation and the executive chair, and all who are working to cause us to have a good product in Sufr. We continue to work on our waterfront project, because as you know, we are in the peak of the season, and we are also continuing work on our repairs and everything else after Hurricane Beryl. So I'm pleased that the timely action with the GPH team and the team at the SRDF in collaboration with the SMMA, we are able to facilitate and have a peak season, and at the same time continue renovation works. The other good news we have for Sufr is that on Friday we had a Renault company, the road company, starting the major works on the Sufr for Shajak Road. Some of you would have remembered that the drivers have been screaming for a little while, and we've been asking for the patience. And now I want to take this moment to thank the Honorable Prime Minister, as well as the Minister for Infrastructure, for causing that work to commence. So the community of Foshajak, Mini, Esperas, and St. Philip, definitely for the first time after decades, the Sufr Foshajak Road is getting significant attention. Today, as it relates to the problems that we're having in the Sufre Bay, my conversation with the SMMA just over the weekend is that they have increased their patrol at the Sufre Bay to ensure that we have safety of our yachts and so on. I think that's important for us based on some of the challenges that we have. Today, unfortunately, we were informed last night that there was a homicide in Sufre. We are in continuous conversation with the police to get the information. And I will keep you abreast, or you'll be kept abreast when we have the details. But I want to take this moment again to speak to our community of St. Lucia, because the issue of sanctity of life is an issue that we have to speak about. And it's not, I'm speaking not just as a parliamentary rep, but as a senior person in our community. All of us must speak to our young persons, the way they manage themselves, and the fact that they just don't understand what life means. So with these few words, I want to, if you have any questions.
First question for me. In terms of the draft bill, the cannabis bill,
Yeah.
in terms of the discussion, is there a time frame where you expect the discussion to be concluded and then thereafter be taken to Parliament?
Yes, I would like to get this bill in Parliament before the ending of this quarter, but everything depends on the feedback that we get. So if we get feedback that would cause us to rework any major part of it, then I would have to shift that time frame, because we would then have to rely on the Office of the Attorney General to make those amendments. But I'm hoping that with all the discussion and conversation that we've had in the past, that we are almost ready to go.
Mm-hmm. In light of what you mentioned, the cruise ships in Sufre and the growing tourism industry in that community, what is being done as Minister responsibility for manufacturing to encourage more local manufacturers, especially small businesses, to take advantage of these opportunities in Sufre?
Oh, everything. Because with the MSME program, in fact, what we do, we target. In fact, just last week, I think it was Wednesday. Last week, Wednesday, I met with my vendors, and the conversation was to tell them, look, we are doing all of these things. We are increasing the tourism numbers. We have brought all the vendors together in an association, and we're trying to talk to them to tell them, you are business persons. We are now giving you credit card machines. You need to revisit the products that you offer. We've trained them in customer service. We are encouraging them to apply for the MSME loan grant program. Some of them have skills and products. We are telling them, look, these products, you need to repackage them. So we are in that conversation in a very big way. And it's not only for Sufre, it's for all of St. Lucia, to tell them that that's your moment. We've had, and we being the Ministry of Commerce as well as the Ministry of Tourism, we've met with the Chamber of Commerce so that they start understanding, because the members of the Chamber of Commerce were complaining that they were not benefiting enough from the increased tourism business. So we have actually sat down together, have a meeting, and tried to see how best we can cause all the business persons, mature businesses and young persons coming up, to seize the moment so that everybody can benefit.
In November last year, you indicated that your ministry would have done a survey to, I guess, maybe the impact of the minimum wage implementation on small businesses. Would you be able to share this with your findings?
We don't have findings. When we have a finding, I'll share. We do not have it yet, but it is an area that we are dealing with.
Madam Minister, the MSME grant program, individuals not taking up the opportunity, is the information not reaching?
No. A lot of persons are taking advantage of it. I think we have closed the second calling, and now we are processing the applications. In fact, the $8.5 million that was assigned to MSME for the all free callings, we believe we have projected, the team has projected that the 8.5 million will not be enough for the second calling. So that is telling you that we have quite a bit of applicants. So we are waiting on the Prime Minister. We presented that information to the Prime Minister. We estimate we might need another just over $1 million just to deal with the callings in number 2. Yeah? Any other question for me? Okay? God bless. Take it easy. You have a question for me? I'm about
department, but within your constituency, your dashing program. What's happening with it?
Well, the dashing program, as I am aware, many people have shipped, many people are selling to Massey. I've had within my constituency maybe another 25 persons approaching that they want support to expand their field. Only last week, I had to intervene and call the CEO of Export St. Lucia because last week, about 3 farmers indicated to me that they are ready to ship. So I was ensuring that I got the link together. So it is working well by God's grace.
My final question to you is the maritime sector within your industry, especially the yachting, the safety of what's happening with it. This year, I know that have been a problem for you, but what is happening with it?
You mean last year it was a problem, but before you came, I indicated that I had a meeting with Mr. Dalson of the SMMA, and he has indicated that he has introduced a patrol with the police and his rangers, and so far things are working well. So we are keeping our fingers crossed on that because you can see we have mega yachts in the bay, and we are also talking. Up to yesterday, I was in Barron's Drive with the guys. We introduced our first small goal competition at Barron's Drive, and all of that is to open conversation with our young men to try to give them different opportunities so that to have a conversation so that they understand their role in terms of keeping the bay safe, because they have a lot to benefit if everything goes well.
Thank you very much.
Thank you.
Morning, everybody. I saw some eyes kind of brighten up on my arrival. It's like that was what I was praying for. Yes, I'm sure members of the media, you all know by now, based on what is trending on social media insofar as bringing the youngsters together is concerned. We felt that there was a proliferation of activity that was not necessarily in the best interest of a society in relation to tranquility and the prevalence of peace. And so some men who are considered the elders initiated bringing them together, of course, called me to participate. And it started last Saturday when we had conversations with the young men. It continued yesterday when we had a day of football. Things happened under a very festive cloud, a cloud of togetherness, a cloud of the prevalence of peace and tranquility. I am indeed happy how it went. And so we have started the ball rolling in bringing the guys together and to refocus their mindset insofar as making and living productive lives. One of the persons who spoke to them yesterday is a guy who was on death row. He actually was on death row, and today he enjoys his freedom. He explained to them that, look, being incarcerated is not anything easy, far less within your mind, knowing any morning you might be called upon for the termination of your life. And he was able to put it in language that they understood. And I can tell you, even the young guys themselves, they have manifested an intention to play their part, because most of the guys are good guys. They are loving guys. It is just that they yearn for acceptability, and they probably find comfort in associating with people who have similar minds and similar trends. And so they find themselves invariably involved in groups that, their intentions are not the best. But the young men have realized that, look, this does not work for me. And so I'm willing to come forward to do whatever I have to do to change my life. And if I can assist others to change them, I so will. And in that regard, I want to compliment them. I want to compliment their parents who permitted them to come through and to ensure that they participated in a venture that is meant to bring a certain degree of calmness to this place. Yesterday, I can say without hesitation or fear of contradiction that there were at least 300 young people present, mostly young men. And it was very, very pleasing. And not at one moment did you hear any one of them seemingly suggested any kind of altercation, even on the tone of their voices. So it went very, very well, and I am indeed pleased about what is happening now. We all know that the only issue is to add a bit of sustainability to the effort, and that we will do. Sometimes you have to be extremely creative, because the young men, what they like and what they yearn for, may not necessarily be what you want to do for them. So, it takes conversation with them, what would whet their appetite, and what would cause them to turn out in large numbers and to participate in voluntarily. So we are working with them, but the end result is to ensure that each and every one of those young guys lead a productive and an income legally generated life.
Question.
Any questions?
That seems within the same context tranquility and peace. For the tranquility and peace without justice, you cannot get that running. As the Lord, no, but let me finish my question. How do you just said 300 young men within the city of Castries? It's easy to say it, as all organizations have done. You come, you speak, but to sustain, that's the problem. We have had many people who have tried. You have Dr. King who have tried, you have Rastaman Cherry who's still trying. It still occurs. It's like a recurring decimal. How do you sustain that? Today they're going to say yes. You have, as you said, 300 men of different age groups in the teens, 20s, 30s. How do you sustain that as a government? That's what I want to know.
Well, you see, I just spoke earlier about being creative when you deal with young men. And I also said that obviously you have to be in discussion with them, because at the end of the day, they are the quintessential feature of whatever you are trying to do. And without their participation, then basically you're engaging in an exercise in futility. So obviously they will give you their ideas. It was their idea that we play football in the graveyard yesterday. And I was surprised. They turned out in very, very large numbers. The sad reality is I started construction of that court. Everybody knows I did it. It's not totally completed yet, and it's devoid of lights. So they suggested on the next occasion, what we're going to do is start off with the finals and then continue another competition. That having been said, you'll understand that if you want something to impact me, you must discuss with me what will impact me. And a lot of times governments fail because of the government's unilateral imposition on the people. You go into a constituency, you might see something needs to be done, but the inhabitants of that area see things differently. And I can give you an example. There was an entity that came to build a school. They built a school in an area, but you had to pass through mud to go to the school. And the parents refused to send the children to that school, notwithstanding it was a new school. If you had asked the parents, they would tell you we want footpaths in those areas. So I'm saying this to summarize that one cannot have, there is no fixed book on any of those initiatives. I remember doing it in 2007, 2008, when I brought rival gangs together. At that time, the heavy concentration of homicides was in Castries Central. And from that year, we had 24 the year before. From that time, it went down from 24 to 12. Homicides reduced by 50%. And up to this day, you will hear of homicides in St. Lucia, but the heavy concentration is not within Castries Central. Okay, it has gone out. So, sustaining it, there is no handwritten book on it. We would have to develop ideas, but one thing I know for sure that is necessary is facilities for the guys to be engaged in sporting and other developmental activities. That for sure is needed. As to how it is implemented, we have to go to the drawing board and determine the way forward on that.
Mr. Minister,
Yes.
you mentioned that you are willing to sponsor programs which these guys, these volunteers, they're under. Now, in terms of the networking, the association, would they be aligned, like say, to the Ministry of Equity? Would there be anything in place to register them?
Well, again, the nitty-gritties of whatever has to be worked out will be worked out. I could tell you, even the Ministry of Sports yesterday came on board. They provided 60 footballs. They provided other things. They are now looking to assist me in ensuring that there is lighting on the court. So, I mean, there are loads of persons who come on board. I got a call from His Grace, Archbishop Gabriel Malze, who wants to come on board, Pastor Ben. So I can't do it alone. I may be part of the think tank, but I am not the think tank in its entirety. And all ideas would be very well received, and those that can be implemented. Reno has given us a space in cul-de-sac, and I want to thank him on media. I want to thank him tremendously because he too is making his contribution to ensure that the young boys are engaged in developmental activities, that they could live productive lives. So all is not worked out yet. It's work in progress. We are getting there. Those are just the initial stages.
The question from Ms. Minister has to do with the parking meters for gas.
Yes.
Could you give us an update? They were installed, but have not been put to use. What is the update on that?
What I do know, you see, the thing is, I can't preempt you. And had I known you would have asked me that question, I would have apprised myself of what the situation is. Because sadly, I'm not one of those ministers who, I don't operate in a fashion where, you get involved in every little thing. Policy directions, I go with them. The last thing I do know is that persons were being trained to man those parking meters. I can find out the latest and revert. But sadly, I don't micromanage, and my inadequate knowledge with that in that regard does not permit me to answer with any kind of accuracy. Yes.
In relation to the CDC buildings, we know that there were plans by the NHC to demolish at least 6. One has gone down. Are we still on with this plans to demolish the other 5?
Well, I'm not sure about demolishing 6. And whose plan it was. It certainly was not mine. At the end of the day, one has to balance the inconvenience caused to persons who reside there and who have made the CDC their homes for a number of years versus making available proper land, good land for developmental purposes. What has to be done, and I'm not saying that it is done or it will be done, the structural integrity of those buildings have to be assessed. I know that was done some time ago, and some of them may have been found wanting in terms of being structurally sound to withstand any kind of, significant tremor. But we can look at it. I don't want to put anybody on notice that we are going to demolish today or tomorrow. If at any point in time it becomes a health hazard, it becomes dangerous for persons to occupy, then invariably as a government we will move in and to ensure that the safety of the people are to the forefront of our minds, and we will do what is necessary to ensure that no one is in harm's way in terms of those buildings collapsing at any time.
What about the residents still defaulting on the rent payments of the CDC? And considering a reprieve was given when administration came into office.
Well, I mean, the whole basis for giving the reprieve was to ensure that persons, at least, because there is this mental barrier that if I owe $30,000 and I come to pay $1,000, it will not be current. It would go to pay my outstanding debt, and it was against this background, to maintain a certain degree of currency insofar as payments are concerned, we decided to give a reprieve supported by the Prime Minister and Cabinet. Sadly, there is this misconception that once it belongs to government, it's free for all. And we have those problems. We do have those problems. We are trying our utmost through writing letters and trying to force compliance in one way or the other. But obviously, there will still be delinquent people who will just not pay. As to what we do with them, it's a very delicate situation, and we don't want us to be running anybody out and putting anybody on the streets without total justification.
Mr. Minister, talking about this litigation, there have been calls by the opposition that 3 women were fired and terminated at the NHC. They accuse you of victimization and racism. What do you say to this? What can you tell us about that?
You see, I prefer answering questions that are factual or factually based as opposed to the proliferation of propaganda. Because in the first place, nobody was terminated. Nobody at NHC was terminated. NHC is currently going through some restructuring. And insofar as the restructuring is concerned, certain positions became redundant. The occupiers of those positions invariably, if the positions are no longer available, we had to sever ties with those persons, but not before paying them over $520,000. One person got in excess of 200 and something thousand, 238,000. So it is not to say that you are deliberately doing anything that would cause rancor or would cause, invariably life must go on. It may cause a certain degree of mental instability, but the thing is, the compensation packages, and when I got to hear of what the decision was, because like I said, I do micromanage, it was the Human Resource Committee that made recommendations, and the board went with the recommendations. It had nothing to do with me. But one of the things I ensured, I said, before those persons go home, ensure you'll have money to give them every penny to which they are entitled. And that was done. They were not terminated, they were not fired, but the positions were made redundant, and those positions no longer exist at NHC.
However, the matter was still taken up by the unions, and from my understanding, went into discussion with the Labour Commission on that issue.
No, the issue that was discussed, as far as I wasn't there, but I can only report based on conversation I had with my senior members at NHC. The conversation centered around whether it centered around the adequacy of notice, not the lawfulness or unlawfulness of the severance of ties between NHC and the individuals. Because if you are running an organization and you have a position, for example, called implementation officer, but you're implementing nothing. I'm not saying that exists in that. I'm being hypothetical. I want to make that clear. And you are implementing nothing. Then the whole post of implementation officer becomes redundant. That name, it does not make sense. So once that position no longer exists, then invariably the whole of that office has to be made redundant. And it is what happened at NHC.
Any updates on the coconut and fish vendors?
Yes. Well, the fish vendors, they should be moving probably in the next 2 weeks. I'm sure most of you know, and again, that's how I operate. We were moving them, but before we moved them, I ensured that we prepared and built another facility to house them, because you see, we are not a government that would just send people on the streets, send persons, displaced persons without some kind of compassion. So we embarked upon the construction of a facility prior to even telling them, and they were part of the process. There were discussions. We called them on the site, and that place is nearing completion. So once it is completed, we will move them, because we want to have that other facility open. And invariably, we cannot open it if the fish vendors are right there. So that will happen in the not too distant future. The coconut vendors, we are in the process of identifying a location for them. It's most likely the gardens. I am not sure. I know the mayor is busy trying to get a location for them, because one would appreciate that they currently sail right at the back of the new facility. And once you take out the hoarding or the boarding, whatever you want to call it, then invariably that just hits you in the face. It is not aesthetically pleasing. And so we need to navigate well whilst taking the interest of earning a living. We do what we do with a balance.
And what's the progress on the amphitheater?
Oh, the amphitheater, you also will soon be invited to the opening of an amphitheater, probably in the next month. It should be completed now. The contractor, I spoke to him last week, and he told me he'll be delivering the amphitheater to me by Friday gone. So I do know it's nearing completion. The last time I was there, it was just a galvanized missing on the roofing. So that will be done. It will be repainted, and we will have the reopening of Serenity Park. All right.
Good morning, ladies and gentlemen of the press. Let me wish you a happy, prosperous, healthy, and joyous 2025 to you and your families. I'm very pleased this morning to announce the reopening of the Viewfort Wellness Center today, Monday, 20th of January, 2025. The health center will provide routine services, but also new services in cervical cancer diagnosis, and also new services in the men's clinic to deal with prostate cancer diagnosis. The health center, as we commonly know it, or the Viewfort Wellness Center, was closed for many weeks to allow for repairs to the ceiling, the roof, and to repair air quality systems. The repairs were very extensive, and based on the reports from the relevant departments, that is the Department of Environmental Health and also the Maintenance Department, the conditions at the Viewfort Wellness Center have improved for both staff and clients. The Maintenance Department continues to monitor the situation today and hopefully will deal with any minor issues which may result as a result of the opening of the Wellness Center today. I wish to thank the administration of the Ministry of Health, Wellness and Elderly Affairs and all the staff, especially those who spent their weekends, especially last weekend, to ensure that the Viewfort Wellness Center is opened today. Additionally, work on the Dr. Martin Didier Polyclinic, or what we knew as the Grosley Polyclinic, will begin this week. Our aim upon completion of the additional structures will be to allow the ministry to take services at the polyclinic to 24 hours. There will also be additional services at the Dr. Martin Didier Polyclinic once the works have been completed. The official renaming of the Grosley Polyclinic to the Dr. Martin Didier Polyclinic will take place upon the completion of the rehabilitation works. Work on the rehabilitation of the Cannabis Health Center or the Cannabis Wellness Center is also scheduled to start sometime this week. Upon completion, we will have improved services and also additional services at the Cannabis Wellness Center. The Dr. Betty Wells Urban Polyclinic started services in December, as I reported before, and hundreds of St. Lucians continue to access services at the Dr. Betty Wells Urban Polyclinic or the former Victoria Hospital. Services are also being accessed at the St. Lucia Eye Clinic, which includes the Cuban Eye Clinic and the Diabetic Retinopathy Clinic at the Dr. Betty Wells Urban Polyclinic. Efforts continue at the St. Jude Hospital and the Owen King EU Hospital to reduce waiting times at both institutions, especially in the Accident and Emergency Department. It is very challenging for both hospitals as we continue to see increases in numbers at the Accident and Emergency Departments of both hospitals. I wish to thank the staff, meaning the doctors, the nurses, the admin staff, and everyone who continues to work together to ensure that the conditions at our health institutions continue to improve. In 2025, the Ministry of Health, Wellness and Elderly Affairs will continue to champion initiatives and also continue the implementation of ongoing projects. Our goal continues to be to increase access to quality healthcare to all St. Lucians and visitors who access our healthcare system. The results of these efforts can be measured and verified. We are pleased to note the increases in the numbers of St. Lucians who access our performance-based financing pilot project activities for both hypertension and diabetes. We are pleased to see the increase in the number of St. Lucians who are receiving pharmaceuticals or medication, as we say, without cost to them. We are pleased to see the increase in the number of pregnant St. Lucians who access our maternal and childcare services under the Universal Health Coverage Project. We are pleased to note the rapid increases in numbers of ladies who access our cervical cancer diagnostic services. We are pleased to note that a number of men are accessing our prostate cancer screening services, and we are very happy to introduce new protocols for snakebite treatment based on our program which took place last year with experts from both Martinique and other places around the world to deal with protocols for snakebite treatment in St. Lucia. I'm also pleased to report that in 2024, we saw improved conditions at many of our wellness centers throughout St. Lucia. There is much more to be done. We wish to state that our government will continue to increase resources to our healthcare sector. We have seen an increase in the budgetary allocations for healthcare since Honorable Philip JPA became Prime Minister of St. Lucia. And we have also seen an increase in the subventions to both the St. Jude Hospital and the Owen King EU Hospital, the Millennium Heights Medical Complex. We will continue to pour even more resources into the health sector in 2025. I wish to list a few initiatives which will take place in 2025. The completion of the Sir Winston Paris or the Dr. Winston Paris Medical Complex. As you know, we have the Dr. Winston Paris Medical Complex or the Sir Winston Paris Medical Complex. And this medical complex is comprised of the secondary hospital, which is operated by the Millennium Heights Medical Complex. It is also made up of the Dr. Betty Wells Polyclinic. And we are refurbishing the old accident and emergency building, and we are going to have a new accident and emergency service at the Sir Winston Paris Medical Complex. So work will continue on this year. Prime Minister has announced, and also the contractor has verified that work will be completed on the newly refurbished St. Jude Hospital at Auger, and we are going to transition from the stadium to the new St. Jude Hospital. We are going to see the refurbishment of even more health centers or wellness centers in 2025. Some of them, I just spoke about the Canries Wellness Center, the Grace Wellness Center in Vieux-Fort North, and many other wellness centers, including Babuno and others. We are going to complete the refurbishment of the Dr. Martin Didier Polyclinic at Grosley with extended services and a 24-hour service, as I mentioned earlier. We are going to see additional rehabilitation at the Owen King EU Hospital. There are many aspects of the hospital that need rehabilitation, and work will happen in 2025. A new wing, work on an additional wing, or the fifth finger, if you want to call it that, at the Owen King EU Hospital will happen in 2025. And very soon, you will see presentations to the board in that regard. An announcement will be made about the future of the Sufr Hospital, a very exciting announcement. And I will leave that to the Prime Minister and the parliamentary representative for Sufr in the not too distant future. We are working on a project which we call the retention of human resources for health, in particular retention of nurses. And we have had discussions with the representatives of the nurses and also other professionals, including professionals in the education sector. And very soon we are going to make what I believe will be an exciting announcement, which hopefully will assist with the retention of nurses and other health professionals. We are going to continue our focus on the sustainable financing for healthcare and also training for healthcare resources. And very soon, there will be announcements about new collaborations among the Tapia Hospital, the Owen King EU Hospital, and the St. Jude Hospital. Our aim is to continue to modernize the healthcare sector in St. Lucia, continue to ensure that we streamline the procurement processes, especially for pharmaceuticals. We want to continue to clear the debt, the millions of dollars, climbing to almost $48 million to date in payables to both local suppliers and overseas suppliers. And we are working to ensure that our human resources for health, we strengthen the human resources for health to strengthen our own health system. I want to assure the people of St. Lucia that this government continues to work in your best interest, that this government cares about the healthcare system in St. Lucia. And this is evidenced by the increase in the number of various kinds of resources, financial resources, human resources, and other resources that we have put into the health system. And as Minister with responsibility for health, wellness, and elderly affairs, I want to assure you that I'm very committed to this job, and we are committed to ensuring that we have much better healthcare in St. Lucia, and we are well on our way. I thank you.
Questions? Quick question. Question for me. Where are we at with regard to a national health insurance program for St. Lucians?
I have heard a lot about the National Health Insurance Program. I heard the last government indicated that they had a program to give X amount of money to St. Lucians for national health insurance. I want to say to you that there is no credible evidence that I have before me as Minister for Health to substantiate this. And if anything was being worked on, there is no evidence that there were any conclusions for the implementation of a national health insurance program. I want to also say to you that this government continues to work on what we call a sustainable health financing model. We are working with the World Bank, and we are also working with a consulting group called JIPA. We have said so before in the public, and we are going to come up with a health financing model which brings together both the the public sector and the private sector. We have been in consultation with the Tapia Hospital. We've been in consultation with the St. Jude Hospital, the Millennium Heights Medical Complex, insurance companies in St. Lucia, the National Insurance Scheme, to come up with a model which is sustainable, which we will be able to finance, which we will be able to fund, and which will be to the benefit of the people of St. Lucia. The difference between what the last government calls the National Insurance Plan and what we are doing, which is the implementation of the Universal Health Coverage Program, the difference is the last government wanted to do something. Now they are saying they could have done it, they should have done it. They spent over 5 years in government and not one additional service in the Universal Health Coverage, under the umbrella of Universal Health Coverage, not one additional service was provided to the people of St. Lucia. You compare that to our system, or you compare that to our strategy towards the attainment of universal health coverage. We came into government and we decided that we were not going to wait for the complete financing model or for the complete financing policy before we provide services to the people of St. Lucia under universal health coverage. So we selected those aspects of universal health coverage or the services that were manageable for the time. So we selected maternal and childcare services. And so far, thousands of St. Lucians have received services at no cost to them. Then we selected cervical cancer services. And so far, hundreds of ladies in St. Lucia are accessing services at no cost to them. Then we went into the prostate cancer diagnosis. And so far, a number of men have accessed the services and more are accessing the services as we go along. So while we are working on the financing model, which is a very challenging proposition, not only for St. Lucia, but for all countries that have gone into universal health coverage or health insurance, and we have looked at all of the evidence from the other islands, the other countries, where some of them started, and the pitfalls and the challenges that some of them are having, and we wanted to ensure that St. Lucia has a sustainable financing model. But meanwhile, we are adding services, the basket of essential services. We are adding services so that the people of St. Lucia are getting services under universal health coverage while we finalize the financing model. Just to say that we are working on a sustainable financing model, and while we are doing that, we are providing services under universal health coverage.
It was a model that was proposed by a team led by Dr. Stephen King. Is that model being considered or taken into consideration as you move forward?
In fact, the team which was led by Dr. Stephen King presented a report in 2017. We have a copy of the report, which is, again, different to what the last government is saying, that they have a health insurance model. I don't have the document from that health insurance model, but we do have a document from the Dr. King-led project. And that report is a 2017 report, which means that work started way back in the time of the last Labour Party government. And the Dr. King report points to the essential package of services and an estimate of what that essential package of services would cost. Now, since that 2017 time, the last government did not continue on the same trajectory as the Dr. King led team. They, in my view, there's been a lot of haggling about whether to do universal health coverage or health insurance, or what they would do, or whether they would bring in a private sector provider. The last government had no clear strategy on universal health coverage or the financing for health coverage in St. Lucia. They had no clear strategy. The Dr. King paper had a strategy. The Dr. King paper gave you the essential package of services. It gave you the rough costs, and there were some steps that Dr. King and his team suggested. But remember, that was 2017, and I guess that was placed on a shelf. So what we did, we took the Dr. King report, and we also took the other reports from way back 2005, there about the Dr. Haynes report and so on. And our team put all of these together And we are working with the World Bank with some new ideas and other ideas on how to do the health financing project, and also with the JIPA team to come together so that Cabinet very soon can get a document that we can take to the Parliament of St. Lucia. So the difference between our approach and the approach of the last government is that, in my view, the last government did not know what they were doing with healthcare financing. They did not know what they were doing. Towards the end, closer to the campaign, they were talking about health insurance for each individual to get how much thousand and so on. But up to now, if there is a document, they should. I haven't seen this document like the Dr. King document to tell you exactly what the premiums would be, who would be paying, how much you would get, and so on. They are just talking about it. In our case, we are not just talking about the thing, we are doing it. We are actually doing it. We are giving St. Lucians services. All of you men inside of here can go to get the prostate cancer screening, and if there are any issues, part of our project can lead you to the urologist, and all of this is at no cost to you. So already we are implementing universal health coverage, although it's in a phased way. And we are admitting as a government that we cannot, at this stage, just put all the services in a basket and tell the people of St. Lucia, all your healthcare is free. We have to do it in a responsible, phased way, so that at every stage we are looking at the challenges, the pitfalls, how can we improve the service so that we have a sustainable health financing model.
The health and security levy will continue after its expiration. I think it was up until 2025.
Yes, well, in terms of levies and taxes, obviously I cannot speak for the Minister for Finance. What I can tell you is that the health and security levy at most will bring $35 million, maybe a little more than that. And that health and security levy is not near what we need for the sustainable financing of healthcare. That is why we have to be very deliberate about what financing model we propose to the people of St. Lucia, where the sources of financing will come, because we know the rough cost of operating just the hospitals. I mean, the Millennium Heights Medical Complex will come at a cost of possibly close to $100 million to operate it. The St. Jude Hospital, for example, comes close to about $45 to $50 million to operate the St. Jude Hospital. If you look at how much St. Lucians are paying for health services at the different hospitals, even now, you'll understand. The Millennium Heights Medical Complex, the Owen King EU Hospital, they collect about 5 to 7 or 5 to 8% in terms of the receivables, meaning when St. Lucians go to the hospital to get services at the Owen King EU Hospital or the Millennium Heights Medical Complex, that hospital collects only about 7 to 9% of what they should collect. At the St. Jude Hospital, the collection rate is much better. Okay? It is now, I'm told, about close to 65% that they are collecting the St. Jude. So in other words, when people go to the St. Jude Hospital, about 65% of the receivables are being collected. So still, that is not enough. Still, it is not enough. What I'm saying to you is that I'm still on the health and security levy, that I'm hoping that it remains, but I'm not the Minister for Finance, because we need the funds in order to provide the kind of quality healthcare that we need. And so the financing model will inform. The financing model will inform.
Just one
Yes.
question for me. You spoke earlier on about the retention of nurses.
Right.
Sometime I believe it was last year, there was mention of giving support to student nurses at for a stipend. Has that kicked in as yet?
Yes, in fact, the government has given stipends to student nurses, but we are working diligently with the Ministry of Education, and the Cabinet and the Prime Minister is very adamant about this. An announcement will be made this year about the kind of support which the government intends to give, not only to boost the number of student nurses, but also to give support to student nurses at the Sufr Community College, and possibly in in other institutions. But we are working very hard. In fact, some documents have been prepared. I am privy to the draft proposals and the documents, and these ideas are being discussed. And I'm very sure that the student nurses in St. Lucia will be very pleased when the government announces the new initiative. But that is an issue. The question of the retention of not just nurses, but our health professionals. As you know, healthcare is the demand for health, for human resources in health is very great throughout the world, not just in North America and Canada, but throughout the world. And therefore, we have to do what we must to keep our health professionals. I wish before I go to also advise everyone, not only ladies, but also young men, to educate yourself about cervical cancer. This month, January, is Cervical Cancer Awareness Month. And the diagnostic services are at no cost to you. We had our pap smears and so on, the regular pap smears, but now there are some new techniques, liquid-based cytology techniques, and our ministry has introduced these new techniques. And I want to encourage not only the ladies, but the whole family to get educated on cervical cancer. It's not just the ladies who have to know about cervical cancer, but also the men, young men, older men, the whole family, because cervical cancer is one of our killers, and if you catch it early, clearly it can be dealt with. So I wish to advise everyone this month, in particular, to focus on cervical cancer awareness. Share the information with your friends, your family, your co-workers, and everyone to do your early diagnosis and so on. Very, very important. Anything else? Yeah, thanks very much.
Why am I graced with such high-profile journalists? Where is Lisa? She's not there?
I'm replacing her.
You're not. Lisa, I thought Lisa would have been there. Good afternoon, ladies and gentlemen. I want to wish you a very prosperous 2025, and thank you for what you've been doing in 2024. We hope you can have a very interesting 2025. I can tell you there are many things in store for the country in 2025. We're looking forward to a very exciting times. Lots will happen in terms of government's infrastructure, in terms of government's human development, in terms of education. I am very, very excited about 2025. We have some headwinds, as most countries. Our headwinds include inflation, the increase in the cost of goods and services, which is a worldwide phenomenon suffered by all countries in the world. It's something that the whole world is grappling to deal with, the cost of goods and services, particularly food in the supermarkets, etc. The government is looking at many things that we can do to reduce it. But as I've said before, the St. Lucia, as far as food is concerned, and St. Lucia is not a price setter, St. Lucia is a price taker. We import much of our food, and we import the many goods that we use in the country, and we import them. We do not set the price for them. What we do there, we do not set the cost. What we set is the price. And the price is set by the private sector after government puts its duties, etc. So it goes very simple. We import the costs, the government puts in the transactions cost, which is duties, service charge, etc., and the private sector sets the price. The only price government controls is the price of control goods, that most of our basic foodstuffs are under price control. The government controls these prices, the markup. But the government does not control the price. Let me say it again. Costs from abroad, transaction costs from internal, duties, etc., and the price by the private sector, except what is on government's controlled list. This is as far as concerned. It's a phenomenon that all of us are concerned about, because all of us buy things in the supermarket. This year, we have initiated discussions with the private sector. They are continuing on how we can cause some changes in the VAT regime in terms of zero-rated items and exempt items. But these discussions we are having with the private sector. I've always said to you that our government is a government of consensus. We do not believe we know everything. We don't believe we have the answers for everything. We want to work together with the private sector. We want to work together with the consumer associations. We want to work together with the public to bring solutions to these problems. But we feel it. We understand it. We understand the increase in prices in the supermarket. We understand it, and we empathize with the people who have to spend more money in supermarkets. But I can assure you that the government every day will look at ways and means that we can control apart from what's happening in the outside. And I'm always asking anybody to tell me, what can government do to change the price of imported goods? What can the government do? I'd like to get the answers to that question. The other pressing matter that I'm sure the Minister of Health brought you up to with is healthcare. There are so many initiatives as far as healthcare is concerned that we will not outline them just one. The Minister of Health told you many of them in terms of healthcare. Next week, we're going to be extending Dr. Martin Didier Polyclinic. And we've been told by the health professionals that St. Lucia's main problem seems to be emergency care, to deal with what is called the emergency services. And talking about emergency services, I want again to beg the public of St. Lucia to drive with more due care and attention. Only in Sufr yesterday, a major accident. And apart from looking for the excuses that we make all the time, half of these accidents, to my mind, would have been, if not alleviated, but the damage would have been reduced if people drove slower. If people drove with more due care and attention, these accidents would have been reduced. We have to exercise responsibility, get back to the situation where there was a designated driver. We cannot drink alcohol and drive. This is, and I want you in the media to join the government. This is not. If you do that, you're not being political. You join the government in saving lives, because you can be driving on the streets, driving, and a drunken driver damages your car and injures yourself or your relatives. So I want you to join us in telling people to be more responsible on the roads. It's a plea that I'm calling out to you to be more responsible on the roads. We can't continue with this recklessness. We cannot. We cannot continue. You notice the police have increased their enforcement. But personal responsibility, people taking responsibility for their own actions, is very important at this time. So in terms of the emergency, the accidents are a great strain on the emergency services of this country. Accidents, the vehicle accidents, a major strain. So in terms of health services, we are seeking to expand the emergency services available, and we want to enter into a new form of collaboration with the private health providers, a new form of collaboration, because we want to have a situation where everyone is on board as far as health is concerned, and you'll be hearing a lot more about it in the coming days. We are trying to improve the physical arrangements for the delivery of healthcare, equipment, etc. Very soon, I'm going to make a statement on how we intend to clear the backlog of debts in the health services of the country. Very, very shortly. From my head, I can tell you, there's a backlog of debts in the services of this country, health services, that may be as much as $90 million in terms of unpaid debts that did not start in July 2021. About $90 million of unpaid debts, which this government is trying to deal with. I can tell you from right now, we owe the health services in Martinique about $2.5 million for health services in Martinique. And I don't want to say about health services in this country. Health services in this country, I'm going to make a bold statement. For the majority of people, is very affordable. That is a fact. The government pays health care for hundreds of citizens every month to go to Martinique. We pay in terms of dialysis. Almost everyone in this country gets dialysis free. Almost everyone in this country gets dialysis free. Nobody is turned away because they can't pay for it. In terms of Victoria Hospital, no one is turned away because they can't pay their bills. No one is turned away. And you know what's happening in universal health care. So I want to say to the public of St. Lucia that as far as healthcare is concerned, the government understands the issues, the government understands the cost, and within our budget, within the financial resources, we are doing what we can. And back to the Health and Security Levy, the figures tell me Health and Security Levy at the end of this fiscal year may raise between $37 and $38 million. And the cost of OKEU alone, as we speak, OKEU alone as we speak, is $65 million. And what the people at OKEU tell me, that they probably need to have $100 million to run OKEU alone. And Health and Security Levy only raises about $38 million. That's what it raised this year. It raised about $10 million last year because it came in late. So, healthcare, we're trying to make it affordable and accessible for as many people as we can. You know about the new developments in testing for some very common illnesses that we have. But again, I want to make a plea for us. I said it in my national address, that let us exercise more discipline in terms of non-communicable diseases, how we can avoid it by our lifestyles. See what we can do. Everybody can do it. Everyone can do it. And doctors tell you we can reduce that impact on the health services if we do something about our lifestyles. We can do something about it. You may recall in the campaign how I was criticized and vilified because I went on a keto diet. I can tell you that did me very well. You understand? I was vilified. I was criticized. Nobody supported me. No one said that the leader of the opposition has changed his diet. You know why? Some of you even reported it. You know what I mean?
Waiting to see the result.
You saw it now. You see it now, right? Okay. So, budget time is there. We want to have the estimate of expenditure in the last week of March and the policy statements the last week of April. So we're getting ready to prepare our budget. I think the country did very, very, very well last year, if I can say. But there are some downside risks which we will discuss. We have one thing I want to tell you, which is something that is very good for the country. It's a sovereign wealth fund. The country, the government is going to pass within this legislative year. If not, within it very early next year, in April or May, but the cabinet is going to approve a sovereign wealth fund for the country. The sovereign wealth fund means that the country is going to use the resources to save for the future generation, to create a basis for the country having some reserves in terms of investment so that can be used for the future. I'm very excited about it, the Sovereign Wealth Fund. It shows that we want to have a legacy of savings. This government wants to create a legacy of wealth creation in this country. Not only a legacy of physical things, a legacy of wealth creation. And that legacy of wealth creation means that a country, a small country with limited resources, can put something aside for the future. And this is why the Sovereign Wealth Fund is going to be passed by the cabinet before the end of this fiscal year. And the legislation will go to Parliament, if not before the end of this year. And when I say year, I'm talking about March. It will go next year. We're very excited about it. And I think everyone should hang on to the idea of the country saving for the future. The country creating wealth for a sovereign wealth fund. So the legislation is going to be there for all of you to see. I hope we can have the first reading very soon so you can read it and you can see the public about it. But we're very excited about that legacy that we want to create in this country. A legacy of wealth creation, a legacy of investment. The country taking the lead in investing for the future. So all young people can decide that, listen to me, we have to make our generation better off than the last generation. And the way you can do that is by creating wealth, by saving. We want to instill, as a country, we want to instill savings and investment in the psyche of our people. And the government is starting it for a sovereign wealth fund. Yes, I didn't intend to stay long with you, but just want to get to you.
Quick for me.
Yes.
In terms of talk about the accidents on the road, and we got a report last year about the number of vehicles being imported, and we've seen what's happening on the road. Is there any intention of the government to review the situation with the intention of putting a cap on the number of vehicles being imported? Has that been discussed at any level?
The truth is that is a very vexing topic that the country must decide on, because you're very correct. The importation of vehicles, I mean, we're getting ourselves involved in modern traffic jams. I mean, you take 40 minutes to come to Chaussee Road to town. But it's a discussion that we have to have also from the environmental point of view. So it's a discussion that we have to have as a country again. But what I intend to do, the government intends to sit with consumers, with the traffic people, with the car importers, and have a discussion on the importation of vehicles.
I have two more questions. My colleague may just allow me quickly. You spoke about the budget. You gave figures for OKU and the expenditure and what have you. It's a bit curious, as Minister of Finance, that for the last couple of years, we're not presented with the budget for events like Carnival and Jazz. Is there any reason why the public is not given what the budget is? I mean, we have a Jazz launch, we have a Carnival launch, but we never quite hear what is the budget allocated for Jazz and Carnival and this event. Do you care to comment on that?
You mean the expenditure?
The expenditure.
Yeah, that's not a secret, I guess.
But we have not been presented. I mean, I know the media have asked before and they've not been provided with that information.
Okay, that information that the Minister of Tourism should have, and there's no reason why he shouldn't give it to you.
And the final question for me,
Yeah.
the Canals Hotel project, where does that project stand right now?
You mean the Galaxy project?
Galaxy, man.
That's what you want to see.
Yeah.
Moving. I'd like to see it move faster. That is the truth. The owners tell us that and there's another issue we have to discuss as a country again: labor. So there are some hard things we have to discuss as a country and take it away from politics. I don't know how easy that can happen considering next year's elections. Next year's elections. There is a hard discussion that we have to have as a country. You know, I just said I moved. There's a hard discussion we have to make as a country about labor. I mean, I give you an example, secrets. They cannot go ahead because of labor. we have skill development. We have a serious discussion in the country, very serious discussion. But hopefully, as I said, that discussion will be difficult to have now because politicians will not allow it to happen. Politicians and the surrogates will not allow it to happen because we're in what is called the silly season. Is going to intensify as time goes. So, but it's a discussion that we have to have. You know, I really wish that our country will come to a point where we have, and this is why I call upon the intellectuals in this country to come out and make serious interventions on issues. Because there are some issues that have gone into the political arena that ought not to go there because they will afflict any political party. They will be of a concern to any prime minister. Some topics: crime, healthcare, cost of living. They will be things that every prime minister will have to deal with. But right now is a time when we think it's good for us to say that we can solve all the problems. Blame one person. It's very easy to do that. But the country, when I'm gone, when the country is gone, because I've always told you that job is a temporary job. When I'm gone, there are issues that the country will have to discuss. We'll have to discuss these issues, regardless of all the spin we put on it now. For our own political reasons. I say we. There are some things that we'll have to discuss as a country. And the sooner we decide that we're going to put some things away from the party and the partisan political environment and discuss it as a country. And you had a very good point. Vehicle importation. Very, very serious point. But no politician will raise that now. You understand? So I just want you to get ready for that because no matter what happens, after the next election, crime will be an issue, healthcare will be an issue, cost of living will be an issue after the next elections, no matter when they're held.
Just to be clear,
Yes.
The delays on the Cannabis project, are you attributing to the labor constraints?
Part of it is to labor constraints. Part of it because there was and I don't want to go into this thing again because going to that thing I tell you something. I've reached a stage of my political life where I don't get involved in halikasi. I'm a bit tired of this halikasi. I want to see about the country. I even notice in my utterings, I don't get involved in name calling and things. So you must have noticed that, right? You must have noticed that because I don't get involved, because this country is at a point where we can take off. It's a very good point. But in terms of guys, I think labor is a problem. I think supply chain issue is a problem because these things come from China. I think the supply chain is a problem. I think these are two main problems: labor and supply chain, and the supply chain issues. But I agree that construction should have progressed more, and we are informing the investor that construction should be expedited, right? But there are many things happening about this project that went overseas that weren't good for St. Lucia. And that's all I'll say. There are many things that were said that's not good for the country. Because this morning it was first year in the first press conference in the year. Let's be on a
Project?
Financing.
Because it was being raised as the
Financing.
project.
I don't know if financing was not in place. I don't know. I heard people say that, but I always knew this project didn't start under me, You must not forget that, And again, I don't want to go into that now. That project didn't start under me. All I say for now. Didn't start under me. It did not start under me. That's the third time. This project didn't start under me. Go ahead.
Health security levy will continue past this fiscal year.
Yes. I've been inside my budget, yes. Only 2.5%. It's not going to increase.
Yeah, yes, Mr. Prime Minister.
Yes.
Wider political discourse.
Yes.
Today, President Trump takes office.
I wish him congratulations. Good.
And I know there's been a lot of talk about the CARICOM of ministers moving together as a group to forward the propositions and the expectations. Is St. Lucia now along with the CARICOM member? Is there? I know it's early days, but is there a plan moving forward? Are we going to negotiate with this new president? Is there a plan in place to get more?
Well, first of all, the St. Lucia government and the people of St. Lucia would like to congratulate President Trump for his re-election as President of the United States. It shows that democracy is alive in the United States. And we congratulate him. We look forward, we always remain friends of America. We look forward to a mutually beneficial relationship for both of us. But in terms of contact with the American government, that will continue for CARICOM. Mia Motley is taking over as the chairman of CARICOM. Contact will continue. And the CARICOM will seek to continue dialogue with the United States as friends, as neighbors, as partners, one much larger and more powerful than the other, but countries that share mutual benefits to achieve a better quality of life for the peoples of our countries.
And in terms of climate change, the seeds.
We will hope that the campaign promise of climate change is not held. We hope so, because climate change is a real issue. We hope that the American government rethinks its position on climate change. The Trump administration rethinks its position on climate change. We hope that they do that.
Yeah.
And if you know that a solution has been appointed climate czar in CARICOM, as he's been dead, and the Prime Minister of St. Lucia is in charge, is the lead Prime Minister on Sustainable Development. Okay. Thank you.
One final question.
Yes.
Okay, so, I realize you mentioned health, you mentioned education, but to me, you didn't zero in on something that seemed to be a problem. Up to last year, we had the highest crime rate.
No, wrong. You must get your facts right. No. You said the highest crime rate. Don't say that. We had a high murder rate. We didn't have the highest. Don't use the word high. We never have the highest in everything. Don't do that. Don't sell the country short. Don't say that.
Let's go down that. Now, what I'm saying, sir, over the last 3 weeks, we saw there was a lot of meetings within certain government ministers on the ghettos, basically to get those guys.
You had the minister here, you know.
Yes. No, I need to ask you that. The final question comes to you. I question him also, but the last one is for you. Right. Now, speaking to the guys in the ghetto, we're talking about sustainability. Yeah, you come, you speak to me. You speak to me. I'm not in a job. How do you sustain it? And what they're saying, yes, we are here. We want to listen to you, but I do not have a job. Now, you already know what I am doing. I need to do something that is legal. And sometimes, basically, the government do not want to speak to me. I want to do something legal. I want to do it. When speaking to them, they will tell you, I want to open a business. I want to do X. I want to do Y. But I'm already labeled. They refuse to give it to me. So then what do I do? Do I have to resort to going back to the same crime? The Prime Minister saying, no, we want to reduce on it. Give me the work. That's what they're saying. Give me the work. So what the question to you, and you mentioned collaboration. Okay? Now you cannot say, I know for sure, in the Central Caspian area, the crime rate have gone down by 50%.
The question.
Yes. The question to you, what do you intend to do as a PM to sustain maybe the gangs within there or to get them out? That's the question I have for you.
To sustain
them.
To sustain the
Because
gangs.
they want to be legitimate. That's what they are saying. I want to be, and we want to have that kind of.
Let me tell you something. I think let's understand something. We must never put people in segments, And that's a mistake we make as a country. We stigmatize people. We say they're from this subject, so they're different. They're not different. There is no difference between somebody who is brought up in one part of the country and somebody who is brought up in another part of the country, except privilege. There's no difference and opportunity. So you must not stigmatize. And a lot of this happens that the people stigmatize themselves and they say themselves, because I'm from that part, I will not get anything. I'm the Prime Minister of St. Lucia. You know where I live? I live in Cashis East. No, Cashis North, for example. That's where I live. I'm the Prime Minister of St. Lucia. You understand? So if it is according to where you lived, I want to be Prime Minister of St. Lucia. What you must do, we must develop a mentality of progress, and we must develop a mentality of fighting the odds. We must stop making these excuses and say because people come from a certain part of the country, they are doomed. What we have to do is we have to make use of the opportunity that's available to all of us. And our parents have to give us guidance. So I do not share the opinion that you're doomed because they say you come from some part of the country. I'm not going to mention any names. You have to exercise the discipline and you have to behave. The way you behave is the way that you're going to be treated. You can't say because you come from one part of the country, you must go to work at 8, take a smoke break at 10, then take and leave at 12. You can't. We must exercise. We have to instill discipline in our people. We can make all these excuses. Of course, opportunities are not the same for everybody. And that is why the government is creating all these avenues for opportunity. There's a National Skills Development Center where you go and you learn a skill. So you must not make excuses. We understand that opportunities are not the same. We are trying to create more opportunity for everyone. But the excuse that you must resort to crime because you're from a certain part of the country, I will not accept it. I will never accept it. Not the crime of taking a gun and put in your neighbor's head and pull a trigger. There can be no excuse for that. I make absolutely no excuse for any young man who will take a gun and go and find another man, another boy that he went to school with, that live in the same neighborhood, and put a gun by his head and shoot him. I make no excuses for that. Absolutely no excuses. But you're right. The government will continue to create more opportunity. And what we're trying to do is we're trying to save the younger ones. The younger ones, those at 12 years, 13 years, that age. We're trying to save them by creating opportunity. And there are a number of programs for the SSDF, for the Ministry of Equity. There are a number of programs. And I think we should try to get these programs advertised more so people can know. There are a number of programs for these young men. But the youth economy, right? But the excuse that you must commit crime because you come from a certain part of the country, I can't take it. I can't. Okay? But you forgot the Professional Football League. We pay youngsters a stipend to play football. We want to do it for cricket. This year we're going to initiate a semi-professional cricket league. So that's again sports, but you must have the discipline. You have to come to train. You have to do what your coach says to get involved, to get paid. Discipline. Okay? All right? Thank you. See you later.